My name is Nicholas Bender. I'm a personal trainer, nutritionist, and director of Walk and Talk Community Interest Company. And we host social group exercise classes, both online and in person, for older adults based in London. Our company's aim is to improve the mental, social, and physical health of our participants by combining exercise with socializing and having group discussions on a variety of topics related to wellness. We're in the midst of a mental health epidemic, a loneliness epidemic, and a physical health epidemic, where older adults in particular are affected the most. Something dramatically needs to change if we are to reduce the waiting lists and costs associated with rising rates of depression, loneliness, anxiety, and chronic disease, especially as the population grows older. I was fortunate to interview the chairwoman of NHS Improvement, Baroness Dido Harding, to learn more about what needs to be done to address these health epidemics.
Every developed country in the world faces this same challenge, which is we're all living longer lives. However old we were going to live, we're all living longer, but we're not necessarily living longer, healthy lives. So we've got to change the model somehow. I think fundamentally, one of the ways you change the model is about individuals being able to take control of their own health in order to extend the proportion of their total lifespan that is a healthy lifespan.
Patients taking ownership of their own health is not something that is traditionally promoted by conventional medicine, where it's the doctor's responsibility to treat illness with the use of drugs, surgery, or radiation, overlooking the importance that lifestyle behaviors can have to prevent and treat disease can teach patients that the responsibility of their health falls primarily on their healthcare system.
One of the biggest challenges for everyone who works in healthcare is that the healthcare, or the rather sick care system, actually is one of the smallest determinants of healthy life expectancy. Education, employment, housing, the quality of your relationships are much bigger drivers of your healthy life expectancy than the quality of your local healthcare system.
But we're in a vicious cycle, one in which many older adults in particular already have one or more mental or physical health illnesses. And so the focus and spending within the NHS is justifiably on treatment rather than prevention. Yet, with minimal preventative or lifestyle programs, waiting lists continue to grow.
In many ways, the only way you break this cycle is by being able to give individuals the access to the sorts of things, such as the work that you do, that enable people to get out of that sort of vicious cycle.
But taking responsibility for our health only works if we know what responsible lifestyle behaviors we should make. Well, one behavior we all know can improve our health is by becoming more physically active. But if only it were that easy. So how do we actually become more active? And more specifically, how can we support older adults in becoming more active? This was the question I had in 2018 when I stumbled across a study from the University of British Columbia that would eventually shape the path of my career and inspire me to start a company in its honor. This study was entitled Walk and Talk for Your Life, and it provided a simple yet elegant solution in supporting older adults to become more active. And that is to make exercise more enjoyable by making it social. It's called social group exercise, and not only might it help encourage older adults in becoming more physically active, but it might also help improve mental health and reduce feelings of loneliness. And so, back in 2018, when I was a graduate student, I reached out to the lead researcher of this study, Dr. Charlotte Jones. Her and I ended up collaborating and set up a walk and talk program based here in East London, where I live. We recently caught up, and I asked her why her concept of social group exercise was so successful.
I think that it's sort of the principle of making exercise a fun activity. And if I look at some of the results of our first iterations, it helped them and motivated them to socialize, reduce their feelings of loneliness by providing a sense of belonging. And I think that's what you're finding in your programs, your walk and talk programs, is that sense of belonging. It appeared that the socialization was the main driver, but also the group exercise and walking component of the program also encouraged the socialization and increased physical activity.
Dr. Jones and I adapted her walk and talk program so that it could be run by a single personal trainer. To ensure this version of walk and talk was effective, we recruited 48 East London-based older adults to test the concept. And because I was a personal trainer, I led each aspect of the course. The Borough of Waltham Forest provided us funding to rent space at a local community center and purchase strength training equipment such as resistance bands, medicine balls, and kettlebells. Participants met with me twice per week for 10 weeks in small groups. Each session began, of course, with socializing, followed by stretching, strengthening, and balance exercises. We then went for a 30-minute walk to our local park, before returning to have a discussion on a health topic over tea and coffee. We discussed subjects such as improving sleep, nutrition, meditation, and other holistic subjects such as finding purpose in retirement, gratitude, and coping with bereavement. Attendance was nearly 80%, and after 10 weeks, participants reported feeling less lonely with fewer depressive symptoms. They gained strength in their lower body and increased their walking speed. The results of this study acted as my master's degree dissertation, but once I graduated, I continued to run walk and talk courses and classes in person as a social enterprise. Following the outbreak of coronavirus, we adapted our classes online and hosted them on Zoom. Our group walk was replaced with virtual walking challenges, where we tracked our daily step counts and virtually walked as a group to various destinations in England and around the world. Household items such as tin cans and chairs were used instead of resistance bands and weights. But we still socialized, exercised, and then discussed a variety of health topics. Our members, who range in age from the 50s to 80s, had minimal issues transitioning our classes to Zoom, and some participants preferred the online classes.
You don't have to commit to so much. You don't have to get dressed, go out, wait, do it, be polite, come out, it doesn't take up your day.
I mean, even though we're not physically together, Zoom is brilliant for feeling connected with people. I think it works really well.
But as the pandemic wore on, we wondered, could this online version of Walk and Talk be as effective as our in-person courses to improve mental health, reduce loneliness, and increase strength and fitness? In other words, could a group of 7 to 10 older adults meeting for the first time over Zoom complete 10 weeks of our program together and end up feeling better, mentally, socially, and physically? And if we could see a similar impact, how that might translate to the future development of social group exercise. So in January 2021, Dr. Jones, myself, and others conducted a randomized controlled trial to test these assumptions. We recruited 78 London-based older adults and advertised the course primarily on Facebook. We uncovered that over half of our participants at the time were suffering from symptoms of depression or anxiety.
I was really suffering from really bad anxiety and low mood. And when I seen your advert, I'd just been talking about, with my doctor, I'd just been talking about walking and diet, nutrition. And because before I had the anxiety, I was always just a normal size 10, 12. And through that, not through the anxiety and the depression, I think more than anything, I was really comfort eating rather than, or sometimes I wasn't eating, it just depended. And so when I seen your course again, that was, oh my gosh, this is just what we've been talking about.
I was really feeling a bit down on myself. And then with all the whole lockdown and everything, that didn't really help either. So I thought it would be nice to obviously meet other people. And also I was putting on a lot of weight because I was stuck at home for such a long time. So yeah, I thought it'd be nice to try and exercise and also meet people at the same time.
People were obviously strangers, and it was probably a little bit kind of scary to begin with, thinking, oh my God, there's all these people, I don't know them and blah, blah. But I think we all kind of gelled together really well, right from the word go, to be honest.
I thought the group worked really well together. It was very relaxed, it sort of felt really easy. There didn't seem to be like a lot of there was no competition between people. You didn't feel like you had to keep up or get ahead. I thought everybody was really supportive of each other.
I like to think I'm learning as well. I think that's a good thing for me. So it was a sort of a learning process, it was a fitness process, and it was a mental health process, and it was also a dietary process.
Following the conclusion of our 10-week course, participants had fewer depressive symptoms, less anxiety, and decreased feelings of loneliness. And these results were similar to the effects observed in our 2019 study, which took place in person. So we decided to conduct follow-up interviews with our participants to learn more about their experiences with this online version of Walk and Talk.
If somebody would have told me at the beginning of the program the impact it would have had on me, I wasn't expecting that. I'll be honest. I wasn't expecting to actually change the way I do my life, and it has, and it gave me that confidence to start the dog walking business, which has had a massive impact on me and my mental health.
Now I'm talking with my GP once I'm working 9 months to taper off getting on the medication. I've realised exercise is integral to my mental health.
It was really nice to talk to other people, hear their experiences, and just basically general stories. Really, just, we always had a laugh, so that was really nice.
A lot more positive about things that I can do and I can get out and about, and a lot less old, which is stupid because you haven't changed my age, but I was feeling an old lady.
Physical measures of strength and balance also improved significantly. Participants reported eating more servings of fruits and vegetables per day and added nearly 20 more minutes of moderate to vigorous physical activity into their weekly routines. What was more interesting, however, was how some participants changed their perceptions about diet and exercise.
I felt like I knew quite a lot about dieting, but now looking back, I think I only knew about dieting and not about healthy eating. And I think doing this course has given me a completely different outlook on that, whereas I'm not looking at calories all the time. I'm sort of looking more at, I think I'm looking at it more from a perspective of health rather than weight.
Think, okay, I'm not feeling great today, but I'm going to get the dogs and we're going to go for a big walk. I always come back feeling better. And I think I got that from one time. I really didn't want to be part of the group. I didn't want to join in. I didn't want to do it. And I did. And I remember the feeling afterwards of how happy I was that I'd actually completed the exercise and the discussion. And actually, I'd forgotten that I was in such a low mood beforehand. So it was a real good value. It was a valuable life lesson that, yeah, you might feel low in mood, but there are things that we can do to improve it without giving into it so much.
If you feel that you're actually an agent in keeping your health out, that's a lot more positive than, the doctor giving you a tablet, isn't it? There's much more optimism, isn't there, in life, if you feel you yourself can do things to increase that and make you feel better. And so there's more purpose to it, yeah.
In the years ahead, it is our aim to continue to run walk and talk courses for older adults. And we hope that with additional support, we can expand, inspiring other fitness professionals to create social group exercise classes of their own for adults of all ages. As a community, we can reduce the burden on the NHS with lifestyle medicine by becoming more physically active, socially connected, and empowered with the skills to take back control of our health. We hope that our model of social group exercise can be one solution to empower us in that pursuit.